Because of our expertise in the field of assisted reproduction, we offer very simple treatments to very complex treatments, a huge range of treatments that are very much tailored to the patient. The very simplest might be a timed intercourse that we can just support the patient with, and the more complex involves genetic screening of embryos or time-lapse embryo selection.
Care Fertility has always been recognised as one of the world's leading IVF fertility groups. But it wasn't until I joined recently that I just realised what fantastic science and embryological expertise that clinical base is placed on. The real advantage of working with Care is the depth of knowledge and research that they have in the embryology laboratories. This is based on over 20 years experience working with some of the best embryologists, not only in the country but in the world, and providing a platform on which we can give our patients the very best chance of achieving the outcome that they want to achieve. We had some of the best outcomes of any clinics throughout, not only in the United Kingdom, but throughout Europe and indeed the world. Here at Care, we can provide that because most of the innovations we've developed ourselves.
So our laboratories are world class. We invest very much in our equipment. We have the best incubators and micromanipulators, which we use for ICSI, for injecting a single sperm into each egg, and time-lapse incubators for monitoring the development of the embryos very carefully. So embryo selection is critical for giving patients their very best chance of success. CAREmaps is a method of embryo selection that we've developed in-house at Care Fertility. And from this, we've used time-lapse images, which are taken every 10 minutes during the embryo's development in our laboratories in specialist incubators. And we can use this data to analyse what the embryo is doing at every particular moment during its time with us in the incubators. Choosing the right one at the right time is critical. We've also done a lot of work with genetic screening of embryos, and we've led the field in these two areas for the last decade or so.
Teamwork is vital. It's not just the doctors that provide the expertise. We have to collaborate not only with our doctors, but with our nursing staff, our scientific staff, our embryologists. It's this uncompromising approach to patient care that I find so rewarding. Every patient is treated as an individual. We recognise that, but we can bring years of world-class research that has been founded in the laboratory and has been brought to the clinic so that the doctors and the clinical staff can deliver that embryological expertise to the patient. We've had many years of experience now. Over 30,000 babies have now been delivered, making us the biggest and most successful clinic in the United Kingdom.